How prepared are you for the next health emergency?
So now we're going to examine how I might account for changing demand on my services in my planning tool. What I'm seeing on screen at the moment is a view across from this year to 2024 of the demand by job type within my intensive care unit. So I'm looking at intensive care. I can, however, be looking at a higher level or a lower level than that. There's a hierarchy that sits within here. So for example, I can see up into the specific hospital that this unit sits in, to within the trust, to potentially within regional, or even within a national level. So this allows me to plan at whatever level I like. I'm just going to stick with my intensive care unit just for simplicity. I can see colour coded the individual jobs which exist within that unit, and I can then see on the pie charts for each year how many of my full-time equivalencies I want to look at. I'm running this one by full-time equivalency. Clearly I could also do this by head count. Typically we find people do this by full-time equivalency. So where's this data coming from? How are we predicting that in 2024 we're going to need this many nurses, that we're going to need this many clinical technicians? Well, it all drives from what we call demand drivers. So I've got some example demand drivers that we typically see within healthcare, and we can talk through what some of these may mean. So within our intensive care unit, clearly one of the largest demand drivers is the number of visits by the public to that unit. So for example, how many patients we have in there. Clearly I can put in information in here. This is showing me annually, but of course I can expand this up and do this quarterly or even monthly, or should I choose to, down even to a weekly level. It depends on how granular you're able to get your demand driver data. Typically we can start to see this by a month level. So for example, we may see peaks in seasonal flu through the winter months and able to account for those by using an expanded version of this timeline. So one of my drivers is the number of people coming in. Clearly, I can also do things like, what's my staffing ratio? How many members of staff do I need to each patient who is within that route? What might happen if my full-time equivalency changed? What might happen if we were able to change the staffing levels, or maybe to change the amount of unproductive time? So I can come into any one of these cells and either manually adjust them. I can use my data tool and spread change over time. So let's say, for example, we're going to drive to decrease unproductive time by 1% year on year. I can spread a 1% decrease using my data tool, just as I would do in an Excel spreadsheet. I might also be importing this information. So this might be past information from last year on the number of cases that have needed to come into my intensive care unit. This might be information from the Office of National Statistics. This might be research information from a university that says that we're expecting this demand in peak activity through COVID-19 through the winter months of 2021. Whole variety of data areas this can come from. There's a very large number of data import tools, a number of data analysis tools, and we can apply a series of mathematical models to these demand drivers. So once I understand my demand drivers, and actually most of the time getting a handle on what these demand drivers are and how they work is one of the key challenges that organisations face, and actually starting to even just understand this area can be very beneficial to a lot of NHS trusts. How does that demand driver specifically affect my individual job roles? So I can see, for example, that my nurse practitioner is driven specifically by the number of consults, whereas my nurses is driven by my required FTE calculation. So the required FTE calculation was actually based on another calculation, so the number of visits times by things like the ratios, etc., and it's using a scaling rate to do that. So demand drivers can build on demand drivers, can build on demand drivers. So once I know that information, I've spread it out over time, I can then start to say, how does that look in terms of my individual entities then, in terms of actual staffing numbers? So again, as we can see, I can see the calculated rate, what the demand rate was. I can put in what the demand is, what the values are, and we can start to do some things around scaling that demand. Maybe we introduce some tools to make us more efficient. Maybe we want to decrease unproductive time, and I can put some other information in there. This then gives me a number of graphical views of that same information set as well. Clearly, I can see the data then as it comes out, what I have and what I'm going to need as time goes on. And if I've got information around how much those individual job roles cost and what their predicted costs are going to be, I can also start to get a handle on what my on costs are likely to be for the individual groups of staff in this case. So I can see, for example, that I've got my clinical technician costs changing over time due to the demand changes that I've got in place. I don't have to have the compensation information in there. If I've got it, it's really useful in terms of being able to communicate effectively to my finance department what a predicted model's costs may be. So we're able to pull that demand information through and actually use that against the supply information we may have previously calculated and have a look at what my demand is looking like. In this specific case, because of the data I've put in, I've got a decreasing demand over time. I would actually expect for most organisations at the moment for this to be rising rather than decreasing, but this is what my demo environment is predicting to me. I can see what the variance between the supply is and what the demand is, and obviously that's giving me my delta into which I need to plan how I'm going to fulfill my gaps.
Start planning tomorrow's workforce today and see results in weeks.